Welcome to the show. I'm Vivian Kopsinger-Birchall, your host, and my special guest is Miss Stella Itungu, all the way from, I don't want to say Uganda or monopolize her in any way, but I'll say Africa, and she'll give us a description of where exactly she wants to be placed. Miss Stella, welcome to the show.
Thank you for having me.
And
it's a pleasure to be here.
It's an honor to have you here. I've read a lot about what you're doing. You're doing amazing stuff, but before we dig into that, could you please tell our viewers who you are and what you do?
Stella Itungu is my name. I'm the CEO of the College of Surgeons of East, Central and Southern Africa, in short, COSECSA. I lead a surgical training institution that examines and certifies surgeons across the East, Central and Southern Africa in 14 countries. Those are member states countries and 10 partner countries. When I say 10 partner countries, they're not member state countries, but they've opted to undertake COSECSA training in their region or in their hospitals. We also do accreditation of training sites and research, examination and standardization of all programs, surgical programs in the region, but also benchmarking on international best practices. Thank you.
Well, therein is it gives us a foundation of where to start. You know, you're bringing together or building capacity of surgeons in the region. But perhaps my first question would be, what brought about the initiation of this program or this initiative?
Yeah, I should say COSECSA was established by the ministers of health of the 14 countries. They came together having looked at the shortage of specialists in the region, not only surgeons, nurses, obstetricians, anesthesiologists, and the brain drain. Most medical doctors that used to come here to upgrade and become specialist surgeons would not go back to Africa. And also they looked at the cost of training abroad, which was so high. So they decided to invite institutions that were at that time having an objective of training surgeons or specialists to retain the health workforce in the region, and COSECSA was one of them. At that time, it was an association of East African surgeons, which was invited, and it became a college of surgeons of East, Central and Southern Africa under the intergovernmental body called ECSA Health Community that is headquartered in Arusha, Tanzania.
Well, it's great to hear that, first of all, the initiative came at the political level, for lack of a better word. But what have been the unique challenges when it comes to surgery in the region?
The unique challenges, first of all, when you look at the population of people dying or those not accessing surgery compared to the population in high-income countries is so huge. Why? There's no access to surgical care or quality surgical care. Even then, the cost involved, you have to move from a rural district to an urban center, and the cost is very huge. So the challenges are lack of access, limited infrastructure, limited resources, not only infrastructure, but also there's that gap between the patient and the surgeon. So there are very few surgeons. According to the World Health Organization, every country must at least have 20 surgeons per 100,000 population. But currently in the African region, it's only recent that maybe 2 of the countries, Ethiopia and Kenya, have 1 surgeon per 100,000 population. And that was the study that was conducted in 2015, and it was published in the Lancet Commission. But the recent one that we did gave us a figure that puts 2 countries at 1, at least 1. The rest are below 1 surgeon per 100,000 people in a certain area.
And I have seen similar statistics even for just the physician density generally. And so when you give us statistics like that, surgery is certainly a critical need for patients who need it. What are some of the things you've put in place to make sure that it's affordable for people who want to study it? Because one of the challenges we've seen in healthcare is the cost of the education itself.
Good question. As a college, we accredit hospitals. In fact, I should have told you from the beginning that we do not have a campus. Our college is a college without walls. We train within hospitals. And these hospitals are placed in rural, urban, and semi-urban areas. So what we do, we accredit hospitals in rural areas, one, to give people access to surgery, but at the same time, the trainees that we are producing are retained in the region. They are retained in their home areas, in their hospitals, in their districts, and in their countries. And presently, the retention rate stands at 93% regionally and 88% nationwide. So to speak of our efforts in bringing surgery close to the people, its accreditation of training sites, and also facilitating trainees with scholarships so that they are able to undertake that surgical training. And because it's a practical in-service kind of training, during their training they are also working. They are working on clinical operations, surgical operations, procedures. So it's the number of people, the number of trainees we have per center, and which translates into the number of patients that are treated, and we call it patient care and health system support. So yes, and currently we have 144 accredited training sites across the region. 54% of them are in rural and semi-urban areas, and that's how we're addressing the issue of access to surgery.
Which brings me to yet another question that's been on my mind since I saw what, I visited the website is, what have been the trends for the surgical needs in the region? Because, saying surgery, there are so many surgeries that could potentially exist. But what are some of the trends on the needs? And how are you trying to address those and fill the gaps?
The trends on the needs, first of all, are on the capacity of not only the institutions, but also capacity on the individuals that would want to undertake that training. And I can say that there's been an impact. I'll first begin from the enrollment trends, especially with our training. I joined COSECSA 5 years ago, and when I joined, that was 2020. That time we used to have applications of around 350 people willing to join the training. In 2021, it raised to 488. 2022, we had 650. 2023, it reduced to 630. 2025, it also reduced. So the trends are fluctuating. They are either regulated depending on the financial need, depending on the situation at that time. For example, in 2020 was COVID, and we saw a drop. We saw a drop of enrollment. So that's on enrollments. So when it comes to trends in access, which is our main focus, and quality, we have an e-logbook. It's an electronic logbook where our trainees register their operations, surgical procedures. And the last 5 years, in the past 5 years, we've had a total of 350 around their surgical procedures, but today we stand at 585 surgical procedures. So the trends, one, the needs are there, but also there's that gap that we are closing with the little efforts that we are putting in. But also you can see that there are some trends whereby some countries, I'll speak about a few countries that did not even have surgeons at all. And you find a country that has 20 million people has like one ENT surgeon. One ENT surgeon. That country is there, and it's among COSECSA member countries. But as of today, the surgeons have increased. ENT surgeons in that country have increased from 1 to 9. There is another country that didn't have plastic surgeons. But with support from our partners, and most of them are here in the US, Operation Smile, Research International, Smile Train. We've supported a lot of surgeons, and that country now has 6 plastic surgeons, and they're focusing on female. So the female trend has also increased. It goes on and on, actually. There's so many things to contribute to the trends. Yeah.
Right. And then again, in the whole context of trends, when we're talking about surgery, what areas or fields of surgery are the most needed in the region based on what you see?
Africa has one main challenge, which is a killer cause, and that's road traffic. So most of our cases are orthopedic due to road accidents, so we're talking of trauma. But also we cannot incline ourselves to trauma and orthopedic. We've seen that in our reports and statistics, there's a balance. You'll find that the women that are suffering from obstructed labor, that cannot access surgery in time. You also talk about kids that are suffering from appendicitis that has ruptured. So I think all specialties are balanced. We'll talk of pediatrics, which is children. Those also are on the rise. But also currently we have a problem of cardio. So cardiothoracic surgery due to lifestyle.
Right.
Yes. So I must say that much as there are some areas that are not on the higher end, but if you look at the complexities, they're at par.
Yeah, it's important that you mention lifestyle, because we're consistently hearing that our lifestyles in Africa, even the United States, but mostly in Africa, East Africa, are changing. And because of that, we are seeing a rise of, comorbidities and, hypertension, high blood pressure, and heart disease. So in your vision for building capacity in surgery, how would you where would you emphasize, in terms of what kind of surgeons to train?
I think all.
All.
Why am I saying all? Because we may neglect plastics, which most people say it's not for Africans. Why change faces or something? But we are looking at cleft lip. That child who is going to live with that stigma for the rest of their time. So cleft lip, these are kids that are produced with deformities, and they live with that. So when you talk of plastics, there is that aspect that needs immediate attention. You cannot say it's not an African problem, and yet it is. So we talk about, we talk about pediatrics, still needed, children. Talk about cardio, needed. Urology, we have a lot of cancer that is happening. Talk about general surgery. So general surgery tackles every aspect of surgery. Talk about ENT, who doesn't have an ear, nose, and throat problem. I think we have to go on and on. I think when I look at all the specialties, we have 9 of them. But we are also developing new ones, which are breast surgery, upper GI, that's gastrointestinal, and lower GI, gastrointestinal. So when you look at the current lifestyle and how people eat, you will see that gastrointestinal is also a problem that is rising. People are having issues with the intestines, and they are suffering a lot of diseases. So I think we need to balance, but also when it comes to resources, we also have to focus on the key issues, key challenges, which brings me back to your problem. What is the most challenging problem in Africa? Trauma, orthopedic, cleft, and appendicitis, women obstructed labor. So all those issues are affecting surgery in Africa.
Yeah, you've mentioned a few things that have, raised my red flag. I'm like, one, the GI, because this morning I was talking to an endoscopist or someone who specializes also in GI research, esophageal cancer to be precise, and he was saying exactly that the rates, especially in the East and Southern Africa belt, are on the rise. But also when you talk about, the cancers, we are seeing a rise of people going to, say, India for surgery, cancer-related surgery. And we're losing, first of all, it's a lot of money for the patient, to go to a different country and also pay money. But also the country is losing in terms of, healthcare, because now the other countries have health tourism, which, so how is that vision of building a health system that the Africans can depend on? How is it integrated in the work that you do, just to, again, address the emerging health issues, but also deal with the very technical surgeries that are needed, and especially with cancer and these rising diseases?
COSECSA is on the right track. One, developing local content and local capacity. It's the only solution. Yes, as we wait on support from other people, other institutions, but I think it's very important to, one, to develop the local capacity. In that way, you are improving the patient outcomes, but at the same time strengthening health systems. And why am I saying so? With all these efforts that are defragmented, if they are brought together, they contribute heavily to the main strategic objective. For example, COSECSA facilitates or supports national surgical anesthesiologists and obstetric plans, NSOPs. So how do we support that? Every year, we provide data, statistics, to the ministries of health on the number of surgeons, on the surgeries, complexities, the distribution of surgeries within the region, surgeons within the region. And that information is given to them and helps them when they are developing their national surgical plans. So in that way, it's easy for them to know where they are, what are the gaps, and what they need to do. Of course, when we talk of infrastructure as a college, we have a limit. Ours is to train within the existing institutions or resources. But then who should provide the resources? It's the governments. So our role is to do what we are mandated to do, which is training, examining, standardization, research, give them the product, but also inform them these are the gaps. Yes, we have the surgeons, but in these hospitals, we should have trained plastic surgeons, but this hospital does not have the equipment for plastic surgery. In Uganda, we should have maybe an ENT surgeon or cardiothoracic surgeon, but even if we produce them, we do not have the equipment in Mulago. So all these speak to the end result of where should the country go or the continent go. And how is that? Through data, through research provided by different institutions that are in the efforts of surgical advocacy.
Right. And then just digging into the administrative part of this, as a CEO, what's your experience working with the different countries and health ministries to support them with your work? I'm leaving it open-ended
that's
because
very interesting, and I like it. Actually, it's been a journey, a very good journey, and a humbling one. Having worked with the health sector before I joined the College of Surgeons, that was with the Global Fund, with the Ministry of Health that time, and it was 2002, 2005, around there. And then I come and work with another intergovernmental organization which was reporting directly to the heads of state. Yeah. That was the East African Community under the World Bank. And we were working with governments, with ministries and regulators and the industry players. So it's all about the experience and how you relate with people, how you connect with people. Of course, you are dealing with different national policies, limited resources, and in some instances, lack of the political will. Bringing so many countries together for a common cause to agree on one thing may not be that easy. But we've made remarkable progress. As a college, we've so far had 1,048 surgeons that have graduated.
Wow, that's a lot.
Yes.
Good job.
Yes, we have currently around 1,250 doing their training. I told you about the surgical procedures, 582. The retention rate is at 90 and above for the region, 88 for countries. And then we've had a focus on women. Women, and I think 5 years ago we had only 5% of the total number of surgeons. Today we stand at 35%.
Woohoo!
Yes, yes.
Go you.
Yeah,
That's
so
amazing.
I think having worked with different institutions in health systems, in integration, international development and policy making and facilitating decision making at higher level has been a roller coaster, but a fulfilling task and role. You get to know where each country stands, what they think of, what do they want to do. Of course, at some point you need to come down to them and tell them, you know, it's only this that can enable you have that.
Right.
It's a matter of negotiating, telling them the objective and the end result, which in the end is to their advantage. So yeah, it's been an impressive and a very good, beautiful journey. Challenges, but fulfilling, and yeah, it's worth it.
Yeah, and one of the reasons I asked that question is, as we're looking at, you know, the world today, you know, our African countries are struggling with tariffs, with loss of funding, and the healthcare sector, which for many countries is heavily funded by foreign, by donors and foreign governments. Has to prioritize, you know, what they focus on. They're dealing with pandemics, epidemics, and other, you know, diseases that have, you know, that have existed for years and years, like malaria. So I'm just trying to, you know, understand, like, how does an organization like
COSECSA,
yes, you know, lobby to prioritize for governments and ministries of health to prioritize on, say, surgery when they have all these other competing needs. And I hear you, you know, talking about, and your experience is great because you have these experience with regional bodies. I worked on NEPAD programs, so I have a bit of familiarity with trying to mobilize, you know, and also to try to get plans into the National Development Plan so that it's funded. So I think it's from that background that I ask these questions, you know, and how best can COSECSA build partnerships to make sure that you know, they support the health ministries and governments.
Thank you for it's a very important question, because we are also looking into how best we can better sell ourselves to those governments for more support. I'm sure you've had quite a number of people sitting in this chair telling you how it's very hard for governments to support some programs, some institutions. Why? There are competing needs, very many competing needs. By the time they think of COSECSA, the budget cycle has ended. So the how is, one, I think, let me first tell you that COSECSA does not depend on governments for funding. much as, yes, we were established by governments, we are supposed to get that funding by their resolution. But you look at it and say, I cannot keep on waiting for government to support. I need to do something. So what has kept us going currently are the collaboration partners. But also the trainees themselves, the training fees that they give. But what I must say that people must understand that surgery is not a luxury. Surgery is essential. Surgery is the backbone of the health sector. In one of the articles, an author called Paul Farmer said that surgery is the neglected stepchild of global health. If you look at the distribution of funding to the different health sectors or health subsectors, surgery comes almost at the bottom, and in any case it may not appear. A lot of funding goes to non-communicable diseases, HIV, Global Fund, malaria. I was in the financial sector and we were choking on money. When I came to the health sector, we are fighting in a small pond of funds, and we do not even get that funds. So I think the best way is for countries to accept that at the end of the day, to save lives, surgery has to be considered. And sometimes I tell people that the distance between life and death is a surgeon. It's a surgeon that closes the gap, much as people don't look at it that way. But better health care, access to health care, quality health care, eventually gives a very good health economy, because you need productive people.
Right.
You need productive people. So it's a complicated way or complicated question when it comes to funding or how it's just a matter of countries accepting, but also we are not training surgeons to be in the operating room. Now, the way we are tackling our how, we are training our surgeons on other aspects, especially leadership. And we want them to take the leadership roles and be on the decision table. Because if you look at many leaders, including myself, I'm not a surgeon. Very few surgeons are up there. So surgeons need to get out of the operating room, go to the decision table where money is distributed. They also say this goes to surgery. That should be the how. Teach them leadership. Show them how to get to the table. Get them into policy offices and let them knock on the doors.
Well, you have mentioned a few things that stuck out. One, you mentioned Paul Farmer. I just recently graduated from Harvard Medical School in his department.
Yes.
Which is the Department of Global Health and Social Medicine. So I completely, he's one of the pillars, you know, we studied the way he approached global health. And one of his approaches was really to make sure that the people in the most rural areas have access to medicine, and understanding all the biosocial factors that limit access to health was critical to, to global health interventions. So in that regard, talking about Paul Farmer's approach, in what ways is COSECSA making sure that the surgery, I know that it's not your role, but in what ways are you advocating for surgery to be affordable for the most vulnerable in our communities that would otherwise not afford it? And I know it might be a question that probably you can't answer, but
it's a good one.
I'm curious.
So we have a scholarship program as COSECSA.
Okay.
And we've approached quite a number of our partners. Please allow me to mention them for appreciation.
Yeah.
We have AO Alliance that supports orthopedic surgeons and neurosurgeons. They give scholarships, but also support them in examinations. They also provide materials for orthopedic surgeons. online access materials. So we also have Smile Train. I'd mentioned Smile Train, Operation Smile, Research International that provides scholarships. And these scholarships are a full package. They give our trainees, and when we are selecting, we consider the need. You have to write a story of why you need the money, because they pay for you from the first year to the last, 5 years in a row. And they give you stipend. In Africa, someone giving you $1,000 per month has paid your salary while you're studying, and at the same time working. So that's how we are addressing the challenge of those that are not able to meet the cost in rural areas by providing scholarships. And we go to several other partners. We also have Kids Operating Room. They are based in the UK, but they support us in pediatric surgery scholarships and development of online materials, but also examination support. We have Intuitive Foundation, which is here in the US, provide research capacity, research methodology course, research workshops, research grants and travel grants to our trainees that are able to write about surgery. And you know, research helps in two ways. There's operational research and policy research. So if we get a lot more people writing about surgery in Africa from the first-hand information, and this information is published, maybe people will get to know where Africa has reached, what do they need, what are the funding gaps, any resources, and what are the training needs. So yeah, we have partners that support us in research. We do have, I hope I don't forget some because I'll be killed by these partners. We have quite a number of partners, but we also have the Royal College of Surgeons, all of them, especially the Royal College of Surgeons, Ireland. Now that one has been with us from the word go. I think since 2007 they've been with COSECSA, from supporting COSECSA in administration, operations, to technical, IT, capacity development, examination development, research, all aspects of the college. But they also provide scholarships, and they are supporting women surgeons. We have few women, but now we've increased the number. We have the American College of Surgeons here. They give scholarships to minimum 20 women each year.
Nice.
Thank you, American College of Surgeons, together with the Association of Women Surgeons here in the US. It's a huge list, but that's how we are addressing the need, and we are helping these surgeons in the region to train and become surgeons, and also support those that are not able to train, but at the same time supporting their families. And that's the reason when we are negotiating, we negotiate a stipend. If this doctor is busy learning, he has a family, he has a wife, he has kids, how does he fend for them? So that's the component of how we are supporting families, but at the same time supporting doctors to become specialist surgeons. But at the same time, there are partners that emphasize certain countries. If it's not a country, and they look at the countries in the need. So that gets me back to the how and why. So certain countries in the need, those that do not have a good economic kind of development, and they're the ones they want to support. Even us, when we are looking for funds, we say, look here, this country needs this and that.
Right.
Yes.
And then as we wrap up, you know, there's one question I certainly have to ask. We are in a digital era right now, and everybody's, you know, pushing and advocating for the application of AI technology to build capacity, especially in rural settings where, you know, capacity is very low. In what ways are you integrating, or are you even exploring that? And I'm sure you are.
Yes, we are.
But in what ways are you integrating technology to train people remotely, and also to build, you know, capacities in technological capacity in the surgical field?
Good question. COSECSA has been, our type of training is both virtual and practical or in service. The Royal College of Surgeons Ireland gives us, it's provided an online learning platform called School for Surgeons. So ours is virtual, online, but how are we advancing? One, we are looking into including the minimal invasive surgery, which is digital. We have also recently brought on board a system called provided by Salesforce, and that system manages the training program from application to processing these applications, approval, enrollment, examination. Our examinations are two parts, part 1 and part 2. The first level, which is MCS for the 2-year program, are fully done online. Fully online. It's only the clinical examinations that are done physically. But we are also developing an app called Find a Surgeon. So that app will help people in the region access the neurosurgeons in Kenya, neurosurgeons in Zambia, pediatric surgeons in Malawi, ENT surgeons in Ethiopia. So that's how we are going digital. On the aspect of AI itself, the discussions have started, and I think it's early in the day for me to start talking about that. But I can tell you that we are on track in terms of digitalizing all our programs and our processes in line with AI developments.
Exciting. I didn't expect anything less, given that that's the trajectory, like with healthcare, not just surgery, but all aspects of healthcare.
Yes.
E-health, telemedicine, there is a lot of trajectory toward that. Is there anything that we haven't talked about, your work, that you'd like to tell us?
Yeah. I want people to know that each year we receive 650 or 600 and above applications, but we are only able to enroll 50% of that number, meaning we are dropping over 300. I don't want to say that all of them lack funds to train, but at least 40% of them, when we do our surveys and ask, why didn't you proceed, you were approved in the system. I didn't have the money. So we are dropping half of the number that is very committed and willing to pursue surgery, but they are not able to meet the cost. That's where we need support from donors, from friends, individuals, institutions, well-wishers, to come in and provide support to that surgeon who is willing to pursue training but cannot afford. Right. Secondly, I'll get back to the gender equity. You and I are women, we need to support our fellow women. Why are we having only 35% of 1,000 surgeons? So women institutions or institutions that support women should come across and support women in COSECSA. Donate and provide that one surgeon in one hospital, in one country, and that will spill over and the challenges will reduce. But I also have to say that COSECSA is the solution to Africa's surgical crisis. We train our local people, stay within their countries, provide surgery within their countries, and speak to the people in their local content. It's very relevant because we are providing solutions that are unique to our very own challenges. We are not borrowing aspects of surgery into a certain environment. It's the very people within you that are training you, and we are also developing the capacity of mentors and trainers. So the viewers here can come to us and support that one surgeon in one hospital, in one country, and this will cascade into millions of people that are trained. Yeah.
Well, Stella, it was such an honor to have you here to learn about COSECSA's work.
COSECSA.
COSECSA. Oh my goodness. I need, acronyms are not my friend.
I know.
Well, it was an honor to have you to learn about COSECSA's work.
Thank you.
Thanks for taking the time.
The
to
pleasure
speak
is
with
mine.
us.
Thank you. It was so wonderfully done. Thank you so much, Vivian.
It's always an honor. I hope I can have you back.
It's my pleasure being here, and I wish I could come back so soon. I have a lot to talk about. I may have left out quite a lot of things, but all I can say, donate, provide scholarships, support research, support that one surgeon, support a female surgeon, support COSECSA.
Right.
COSECSA, the only solution to Africa's surgical crisis. Join us in fighting that cause, that problem, and save a life.
Save a life. You heard it. And to all our viewers, I hope you've learned about this organization, and you can learn more by visiting their website that is at the bottom here. But for now, thank you for watching. Till next time.
Thank you.